I'm Nicole Dawson. I'm an assistant professor in the Division of Physical Therapy at the University of Central Florida. On behalf of my colleagues, Dr. Ashley Trapezzano from Brooks Rehabilitation and Dr. Catherine Judge, who's a full professor in psychology at Cleveland State University, and she's also an adjunct research scientist at the Benjamin Rose Institute on Aging. We'd like to invite you to our two-part educational session called Leveraging Existing Abilities in Dementia, Parts 1 and 2, at the Combined Sections meeting of the American Physical Therapy Association in Denver, Colorado. So, patients with dementia, they're a really challenging but very rewarding patient population to work with. And as a geriatric physical therapist, my job is to help all older adults age as successfully as possible, especially those with dementia. Now, statistics estimate right now that about 5.9 million older Americans have dementia and are living with it either in the community or in a residential care facility. So it's likely that a physical therapist will have encountered a patient with dementia regardless of the setting that they're in, whether it's in outpatient orthopedics, whether it's in acute care in the hospital, inpatient rehab, and predominantly in skilled nursing and long-term care. Research does show us that even though these patients are challenging, they can benefit from rehabilitation. And this is actually a common misconception because we think that because of the challenges that we see with them, that they're not able to benefit, but they absolutely can. Now, however, many of these successes are not as widespread as they should be because of some of the barriers that therapists and other rehabilitation professionals face while providing these services. So some of these can just be knowledge of the dementia process. It could be confidence in communicating with these patients, or really just understanding what the best practices are and how to facilitate them to engage during treatment. So to overcome these barriers, my colleagues and I, we developed a rehabilitation framework called LEAD, Leveraging Existing Abilities in Dementia. And that's what we're going to talk about at Combined Sections meeting. So the first part of our presentation is going to really go through and talk about dementia knowledge, increasing your dementia knowledge. What is dementia? How does it progress? How is it different than normal cognitive aging? And then we're going to dive into something called the strength-based approach, which really is what we use to develop the LEAD framework and really differentiate that from the medical model. And then we're going to go into the LEAD framework and how it was developed, its theoretical principles, and the three pillars that we call the 3 C's. And so that's communication, coping, and cognition. And we're going to show you how to use a strength-based inventory to really be able to identify the strengths of your individuals with dementia that you're working with. And then in part 2, we're going to teach you how to integrate this into your daily practice. We're going to review all of the strength-based and evidence-based best practices that we use in these 3 C's, communication, coping, and cognition. And then we're going to end the session by doing some case studies and some discussion and active learning to really get you to practice these different techniques so that you can integrate them into your daily practice. Thank you, and we really hope to see you at Combined Sections. Part 1 is Thursday from 11 to 1, and Part 2 is Friday from 3 to 5 p.m. Thanks so much.